Hey, I'm Sarah Lawler, and I want to talk about chronic pain today. I want to talk about risk factors because it's just good to know. But according to the CDC in 2021, about 21% of the American adult population suffered with chronic pain or were diagnosed with some kind of chronic pain issue. Now, I think if that was a reported number, that the number could be higher, obviously, but that's just what we have, reported numbers. Now, getting into some risk factors, I'm going to pull some risk factors that I found from clevelandclinic.org, but also maybe give a little bit more insight for what I see in my clinic as well. So according to the clevelandclinic.org, genetics can be an issue. So let's say that your mom suffered with migraines, you might be more likely to also suffer from migraines, like things like rheumatoid arthritis, stuff like that will just predispose you. They say aging, and they kind of chalk it up to just normal wear and tear. Previous injury, a manual labor job or physically demanding job can also predispose you. Smoking, obesity. This next one is one that I see often, and I will say most of my chronic pain patients have this specific risk factor, and that is frequent or severe stress and or PTSD related to some kind of trauma, whether that be a toxic living environment or like events that happened to them that were traumatic. Those predispose you to having chronic pain. And then also I will say that being a woman is also, you're more likely, unfortunately, and they believe, now this didn't come from the Cleveland Clinic. It didn't say anything about women. I've read this other places, but I will give my insight. Women, they believe that they process pain in a different way, and that might be why they might be more likely to have that as a risk factor. Like they might be just a little bit more acutely aware, like their bodies are a little more aware of what's going on. Now, the reasons why it's good to know the risk factors is because some of them are modifiable and some of them are not modifiable. So if we have modifiable factors, like obviously you can't do anything about aging, you can't do anything about your genetics, but you can do other things. Like if you don't have chronic pain now, but you know that smoking could predispose you to having chronic pain. Everybody knows you're not supposed to, like, smoking's not great for you, but it's just another maybe encouragement to stop. And so there's just some things you can do, modify some behavior, but there's a lot of things you can't modify. And chronic pain is very complicated, very frustrating as somebody who, that person who has the chronic pain, so frustrating, so isolating, because it's hard to find answers. It's also just really difficult to just always be in pain. It just is. But I hope these risk factors might help you, or just so you know them in general. And then maybe if you are someone that suffers from chronic pain, you can kind of link back, oh, this might be a reason why. And I do think sometimes knowing those risk factors, even if you already have the chronic pain, might help you work through and help you manage some of those symptoms. Okay? Hope you're having a wonderful day, and we'll see you soon.